So since you were working in a clinic, did you also have to adapt to the telehealth aspect? You had, because I'm sure you weren't doing no telehealth, right?
Nope. That shit sounds nice, but nope.
Right, because when the telehealth was coming out, I was like,
telehealth gunshot wound.
what are you doing? Bro, just stick your finger in there and pull it out, man. It's like, it's not that deep, bro. If you can talk to me, you're fine. Yo, be like 50%. Yo, just spit it out. Like, so, because like when I saw this telehealth shit, I was like, yo, baby. If you could, like, I would imagine there being nurse practitioners who's only telehealth. And then we can go live in like a fucking island and be on the beach and be like, oh, yes, what? Okay, yes, just take these medicines, okay, next. Swipe. I don't gotta be nervous. Swipe next.
That definitely sounds like tuberculosis.
Over. 20 minutes is over.
No, I love telehealth.
Really?
I do, because it's like business on the top, party on the bottom.
Right, like boom. Yeah. But did you feel like your ability to diagnose wasn't hindered by that?
Yes, because you can't see everything. Like a person come in for ear problem, I can't see them in the ears, and it's like they get frustrated with me, and I can't prescribe nothing if I can't see it.
Right.
Technically by law.
Yeah, yeah.
So it was kind of hard, and then you have the older patients who didn't know how to use a computer or use a phone. Or, video chat with me.
You're
so
on
that
mute.
was hard. Right. And then, like...
What?
There was always barriers. Like, if I didn't speak Spanish, I don't have an interpreter. Like, I usually have in the clinic someone to speak Spanish for me. So that was kind of hard.
You know what, man? I just thought about that. That telehealth, if it had subtitles with the bouncing ball, like you should Google Translate on the video right on the bottom.
It's coming.
Come on, stop.
It's coming.
It's coming. I just said it out loud, so brother, yo, I better get a check. I just want my 15%.
They're gonna NFT that shit.
We're not putting that one in.
You blurring that out. I'll be like, yo, you know what would be a really good idea?
Nah, that's a great idea, actually.
Like, you could work on your own time, wherever. Like, I used to live in Connecticut. I used to work in the backyard. So it was good.
Life is good.
Life was
And
good.
is that can you get that job? Like, are they hiring for just that position, or is that something more that?
Like, I have a second job that I just do COVID results, and that's it. So I can just talk to anywhere, anytime, make my own schedule. That's my job. That's it.
Okay, so I kind of wanted to ask, because you're doing the COVID results, right? What do you mean by that? So, like, you're getting the tests and you're analyzing and then being able to say, oh, you have COVID. Is it a top positive test?
You just read them the answer?
or then he said you give him a call. Yo, you got it. Just Yo, you just got that shit, boy.
You got the bid.
You got that clap.
We ordered a syrup
Well, whatever company that you work for, they have a lab. So they send a result and it says either negative or positive. So you're literally just reading it. And then, you're literally just reading it. And then the patient's going to ask you questions. Like,
Tons of questions.
How, do I quarantine? Can I get a doctor's note? Can I get some cough medicine? What can I do? Blah, blah, blah. So that's what I'm doing.
Because I wanted to ask, because there was a lot of like talk about like false positives and false negatives. But I'm sure like you did like that. I would have to ask somebody in the lab to like kind of explain how could you falsely test positive for something that you don't have.
That's a great question.
In your body. Right, if it's not there, how can a false positive ever come to fruition? You know,
it could be not enough sample on the swab.
But if it's not enough,
It should come
but
out.
so if it's not enough sample on the swab, the test is gonna be like, you got it. I'm gonna say yeah. It's not no boogers on that shit, so you got it. Yo, what?
Well,
Like
that's
the opposite of reasonable.
being on that side,
You're guilty.
being on that end of the, like, when I get those results, I'm like, well, there's not enough samples, so you gotta retest.
Oh, okay.
yeah.
So maybe they say you're positive just to emphasize that you got to test again. Yeah, but that will fuck somebody up, man. You know what I'm saying? If they say you got,
You might got it.
You might have got it. You got half of it. You got the cold. I don't know if you got the vid, but you got COVID. You got COVID 9.5. Yeah, man.
He's like that, bro.
Yeah, but I mean, like, Rowen, you obviously could not have done your job like remotely. Like, no. I mean, no. Like, I mean, and it was like it was interesting because there was I was seeing like a lot of like discussions about this for the super wealthy rich, but like having like this futuristic existence of having this device that can like look in your ear and like, you know, hook it up to your computer, and then be like, oh, just put it in your ear, put it in your nose, you know what I'm saying? Blood sample, put it here, and the data, this little box will be able to like send the information to you, and you can diagnose. Whereas like physically,
that was a scam, right? Wasn't that like that Hollywood, some shit? Some lady made a machine like that, and it was just a scam.
Well, no, I know there's people who are developing something like that. It's like a little box. And you could like prick your finger and get a little blood sample or something, and it can read, do all the like checkup stuff.
The shit for like insulin, like right?
Insulin is like there's a little device but what I'm saying is like it's like this little box that has all these things that you can just do the checkup, like a regular checkup, and you as a service provider could be like, okay, I see the data. All right, you're need to worry about this, you need to worry about that, or this is fine. So for you, it's like you would need a whole robot to like come and like pull the dildo out of their ass that's like in their intestines and some shit.
I've actually seen that before.